The hardest thing I've ever done was getting on the plane to go to Afghanistan and say goodbye to my wife. And on the flip side, it was also the best thing I've ever done was to be able to give her a hug when getting off the plane when I came back. I didn't always know I was going to be a doctor. When I was in college, I played football, and I was the place kicker and punter, and I tore a muscle in my kicking leg, and so seeing the process with the athletic trainers to the physical therapist to the team doctor who was an orthopedic surgeon, that was the first incident that stood out. And then once I got into medical school and got through the preclinical years, the first time that I stepped into the trauma bay in the emergency room taking care of patients who were just in a car accident, being able to see how well the team worked together to save lives in an emergency situation, that's when I was hooked. I joined the Air Force after graduating from college, and so I was part of the surgical squadron that was stationed at Bagram Air Force Base and the Craig Joint Theater Hospital, and so we were functioning as the central hub for all medical care in Afghanistan. We were able to administer the same quality and level of care that we could offer in the United States in the middle of Afghanistan. We treated blast injuries, gunshot wounds, motor vehicle crashes, infections. What did I learn from my experiences in the Air Force? They taught me a lot about perspective, family, priorities. I've made friends that will be my friends forever. And there's a bond there with veterans that is very special to me. I admire my wife. She is a full-time surgeon and a full-time mom and a full-time life manager for me. And she's able to do it with a smile and an enthusiasm that is very, very inspiring to me. Right now, we enjoy taking our sons to the park and watching them play and watching them grow. It just makes everything worth it. The importance of a balanced professional and personal life can't be understated for overall happiness. You have to make time. You have to carve out time and say, I'm not going to do work right now. And a lot of times that's really hard to do, but it's very rewarding and it's rejuvenating. The best part of my job is talking to patients to be able to help them. They come to you with a problem and they're in pain and they're hoping that you're able to help them, and most of the time we are able to help them to a significant degree. But forming those relationships and seeing them get better and developing trust with the patients, I think, is the most rewarding part of my job.